A donor's identifying details will be maintained by the authority on the confidential register of treatments. In 2005, a law was enacted in the UK to remove donor anonymity in a controlled way. This means that children conceived using donor sperm, now oocytes or embryos, have the right to access from the confidential register. They can access anonymous information about the donor and any donor-conceived genetic siblings from the age of 16 years. They can have identifying information about the donor from the age of 18 years. They can also have identifying information about donor-conceived genetic siblings with mutual consent from the age of 18 years. They can have information about the possibility of being related to a person they intend to enter into an intimate physical relationship with from the age of 16. Parents, from the date of birth of their donor-conceived child, can access information about the number, sex, and year of birth of their children's genetically related donor-conceived siblings. The donor's identity will not be made known to patients. Likewise, the names and details of patients will not be disclosed to the donor. However, non-anonymous information about the donor will be made available to the donor-conceived child at 18 years of age, including full donor names and any previous names, date of birth, and town or district where born, and last known postal address or address at time of registration. The oocyte donor does not have reciprocal rights about knowing the identity of the children born. The donor will be able to access the following information related to their donation: the number of children born, their sex, and their year of birth. Let's now talk about consenting and withdrawing or varying consent by the egg donor in preparation for oocyte donation. A donor needs to provide their informed consent for the storage and use in treatment of their oocytes. Information about oocyte donation will be provided verbally and also using information sheets and online through the Fertility Consents online consenting platform. Some information may also be discussed in the counseling appointment all donors must undertake. You have opportunities to ask questions and clarify your doubts. The importance of counseling before consenting has been discussed earlier. An oocyte donor has a legal right to withdraw or vary their consent to store and use in treatment their oocytes or embryos created using their oocytes up to the time of treatment of the other person. This can be done by writing to the clinic director, Dr. Oocyte at Acorn Fertility. In such a case, further treatments using the donor's oocytes will stop completely or in part. Such withdrawal or variation of consent can have significant hurtful and disruptive impact on patients who have planned treatment using the oocytes. So potential donors must be as certain as possible of the enduring nature of their consent to store and donate their oocytes for use in the treatment of others. This is another good reason we insist that donors have a session with our counselor to discuss the implications of the donation process before proceeding. Donors and recipients always ask if there is any limit on the number of children created using a donor's oocytes. The limitation is more about families created, not the total number of children. The oocytes from a donor can be used in treatments which create up to a maximum of 10 families in the UK. The precise number of families is determined by the number the donor gives permission to, but it must be 10 or less. When a donor's oocytes are selected for use by a patient, a family slot is allocated and remains with the patient if treatment results in a live birth. If the patient has further live births using the same donor, they are counted within the patient's single family slot. If the patient does not have a live birth and stops using the donor's oocytes VW, the family slots can be relocated to another patient. A lot of potential donors ask about the compensation they can expect for their oocyte donation. As per the General Direction 0001, oocyte donation must be altruistic. Compensation can only be provided for expenses and inconvenience. For donor oocyte stored after 1st October 2024, the compensation limit is a fixed sum of £985 per cycle of donation. Compensation for expenses over £985 can be provided, but only if the expenses are reasonable and incurred in the direct course of donation activity. If there are genuine additional expenses, we may be able to pay those, but only against receipts. If an oocyte donation cycle is not completed, donors can be compensated a fixed sum of up to £45 per clinic visit. We strongly promote counseling at Acorn Fertility and require all potential donors to have attended at least one implications counseling session before progressing to donate eggs for use in the treatment of others. This session is needed for donors to understand the social, ethical, and legal implications of donating eggs, and for the counselor to assess the potential donor's suitability. We know a donor's gametes and embryos created from them may be stored for up to 55 years before being used in treatments to create up to 10 families, depending on the donor's consents. Persons conceived using a donor's gametes can contact the donor when they reach 18 years of age or thereafter, so it is therefore possible that a donor may be contacted by persons conceived using their gametes multiple times throughout their life, even into old age. So let's take an extreme example. If a donor is 24 years old now, somebody conceived using their sperm reaching 18 years old may try and make contact when the donor is up to 98 years old. Thus, there may be considerable differences in age between the donor and donor-conceived persons making contact, but also between the conceived persons. The impact of such contact on the donor's own family will hopefully be positive and can be positively managed, but this is not assured and negative impacts may occur. It is important to discuss all implications of the donation process.